So today our focus is on prevention, and there's so much that I could tell you about detection and signs and symptoms, but I want to talk mostly about the prevention. We're going to be talking about 2 or 3 things. First of all is primary prevention, things that you should do as your behavior, secondary prevention, and we're also going to be talking about some of the legislative activities on the national and on the state level. So skin cancer, we have 5 million new cases of basal cell squamous cell and melanoma. Basal cell is the most common, least dangerous. Melanoma is the least common but most dangerous, as I've mentioned. A lot of people think that cancer is just simply a combination, that you get it because you've got genetics, you've got a bad environment, or you maybe just have bad luck. Well, actually, I think that's a very fatalistic view, which I don't share in melanoma, because we know that 86% of melanomas are associated with sunlight and artificial tanning exposures. So who gets melanoma? Who gets skin cancers? Well, I can name some people. Bob Marley. Did you know that he died at age 36? He died at age 36 of melanoma of the great toe. So the lung cancer, the tobacco didn't cause the toe injury, Dr. Dayton, but Bob Marley died, and he had a sore that wouldn't heal on his toenail. He was told that it was a soccer injury, and he should stop playing soccer, do this and do that, and of course, it metastasized, and he died at age 36. So primary prevention are things you avoid the sun. Well, what's secondary prevention? This is one of them, is you do your own total body skin exams. Look at yourself on your birthday suit once a month or whatever. Go see a professional for total body exams, especially if you're a high-risk individual. Get a trained dermatologist to look at you. And what you're looking for yourself, as well as what the dermatologist looks at, is what we call the ABCDE rules in moles. A for asymmetry, B for border irregularity, C for color variations within and without, D for diameter larger than a pencil eraser, roughly 6 millimeters, and E, probably the most important of the ABCDEs, is E for evolving, E for enlarging. And this is what patients report to me, is this is a new mole, this is a changed mole, something's not right, and I can tell you that so often patients are so perceptive. Preventing skin cancer is very doable, it's very simple. You look yourself, you do a few little behavior changes. It's very low cost, this does not require high-tech equipment. It's low risk, there's nothing invasive. We don't have to pass scopes down your lungs or colon things or whatever that other cancers do. The equipment is not expensive, and we have a very high rate of finding skin cancers earlier and earlier, especially when patients are a part of the team.